Good morning, good afternoon, and good evening. I hope you and your families are safe and healthy. My name is Diana Silver, and I'll be the moderator for today's webinar. I want to thank you for joining us. Before we get started, I want to provide you with some technical instructions. The webinar will be conducted in English with simultaneous translation to French and Spanish, and you can use the translation icon on the bottom of the screen to choose one of those languages. There are moderated discussions after each of the speakers' presentations, so you have an opportunity to ask questions of them. Please use the Q&A button on the bottom of your screen to submit questions, and be sure to include your city when you do. I also want you to feed your questions into the Q&A right as they occur to you. You don't need to wait until after the end of the presentations. Also, we're going to launch 2 polls during the webinar. Please respond to them. As I said, my name is Diana Silver, and I am a professor of public health policy at New York University School of Global Public Health. I want to welcome you to the Bloomberg Philanthropies Partnership for Healthy Cities COVID-19 Global Leadership Series. This series of 60-minute webinars for city COVID-19 and other health agency leaders is one of the resources the Partnership for Healthy Cities is offering to its global network to boost their local response to this global crisis. The series is supported by Bloomberg Philanthropies in partnership with the World Health Organization and Vital Strategies. In a moment, we'll be joined by Aaron Schwid at Vital Strategies, who provide an overview of some of the key legal and ethical issues that have emerged during the COVID-19 response. And you'll have a chance to ask him some questions. Then we will move on to our Spotlight on Cities and be joined by Chiluchi Anyamalukwe, a legal expert in health law and ethics from Nigeria and a practicing lawyer. And then there's you. You're joining us from over 45 cities around the world. The purpose of these webinars is to provide updates on the evolving COVID-19 science, expert briefings on responding to the pandemic, and opportunities to share your own city experiences and challenges. The objective of today's webinar is to focus on legal and ethical issues you're facing as part of responding to the pandemic. Last week, we heard from experts about communication strategies and got insights from your colleagues, emphasizing the need for transparency and for a coordinated response across sectors to address the epidemic. Many of you raised concerns about how to counter misinformation and deal with conflicting messages, as well as how to protect vulnerable populations and manage the economic and social costs of the response. This webinar dives into these and other related issues. As you can see, the pandemic continues to be a worldwide crisis with over 3 million cases and over 216,000 deaths worldwide. Nearly every country in the world is reporting cases. And as you can see, while the rate of cases doubling is no longer quite as rapid, 3 hotspots where cases are doubling in under 7 days have opened in Sudan, Somalia, and Ecuador. Meanwhile, cities remain critically affected by COVID-19, with new challenges emerging from local governments, particularly in how and when to ease physical distancing measures. With this context, I'd now like to turn to Aaron Schwid, the Legal Director of Policy and Programs at Vital Strategies. Aaron is the Legal Director and has worked in more than 50 countries to strengthen the enactment and implementation of public health laws on a variety of issues, including epidemic prevention, nutrition, tobacco control, road safety, sexual and reproductive health, civil registration, and vital statistics. Just as a reminder, please put your questions for Aaron into the Q&A function as they occur to you. Aaron?
Hello, everyone. I appreciate you all joining, and I appreciate all the work you are doing globally to respond to this pandemic. We're going to start today with a little hypothetical. So what I want you to do is please think about how your city should respond to this situation. Imagine there's a COVID-19 outbreak and a shelter-in-place measures or other strict physical distancing measures are required by your law. A rowdy crowd of young men start to gather on the street. The crowd is growing and they are not following any of the distancing measures. The police yell at them to disperse, to go home, but nobody moves. What should you do in this situation? Do you have the police arrest everyone on the street and send them to jail? Do you issue fines but send everyone home? Do you send health officials to explain the dangers of COVID and the rationale for staying home? Do you offer people money or other benefits? Or would you request that the national government send additional personal protective equipment or PPE like masks and gloves to your city hospitals? Please take a few minutes to think about your answer and select the one on the screen. Okay. There's no easy answer to this question because we don't have enough information about the people on the street and why they are there. The picture on your screen shows members of the Young Doctors Association in Southwest Pakistan. Than 50 of these doctors were arrested for protesting the lack of PPE for frontline health workers. 50 doctors at the beginning of a pandemic locked in cramped police vans and jail cells. If only one of them had COVID, what would this do to the city's ability to respond? Now, in this case, it was doctors who were arrested for protesting, but it could have just as easily been nursing home staff, grocery workers, food producers, cleaners, transportation drivers, or other essential service providers protesting the lack of safety standards. So how do we apply the law to people on this? How we apply the law to people on the street will have a direct impact on our ability to respond. City governments play a crucial role filling any gaps in national, provincial, or state laws and implementing national policies. And they use their discretion to tailor policies for the local context. Even where the role of the city is limited, cities play a role advocating for the residents at the national level. So I hope this information is helpful to you no matter what the role of the city. A comprehensive response to COVID will require applying many different measures that shift as we progress through the different phases of an outbreak. Many of you have seen this slide before. Although the timing and severity will vary from place to place, almost every place will progress from trying to contain a few sporadic cases through using mitigation techniques to slow community transmission until you hit until widespread transmission hits a peak. Then transmission suppression methods will push the cases count back down into the recovery phase. This coordinated response requires measures to box the virus in, like individual hygiene, wide testing, isolation of infected people, and contact tracing to identify people who may have exposed so that they can be quarantined. You also have to put measures in place to manage COVID patients and maintain other health services while protecting health workers. And while we wait for an effective treatment or vaccine, we have to rely on these physical distancing measures to slow the spread of the virus. These physical distancing measures include school and work closures, canceling mass gatherings, travel restrictions, banning all non-essential services, and in some cases, curfews. And these are really all the tools we have at this point. Now, based on virus transmission, public health capacity, the economic situation, other factors, governments will need to decide when to impose certain distancing measures and when to lift them. So 3 points with this. First, this is likely to be an iterative process. When cases are increasing, we impose measures to flatten the curve, and then we can lift them once cases start to get under control. Cases go up, we have to clamp things down again. Cases lighten, and we can start lifting the restrictions. And the process repeats until it's stabilized. Now, second, speed is everything. If you wait too late to implement distancing measures, you may have a much higher incidence and higher rates of death, like we see in the top picture. It can overwhelm your health system. But if you impose them early enough, you may be able to flatten the curve, like we see in the lower picture. One illustration of this. In early April, epidemiologists projected that 60,000 people in the United States would die from COVID using calculations based on a model by the Institute of Health Metrics and Evaluation. They estimated that these physical distancing measures, if they had been in place 1 week earlier, there would have been 37,000 fewer deaths. 2 weeks earlier, we might have seen close to 6,000 deaths, or 90% fewer than the 60,000 projected. So speed is so crucial with these measures. The final point, distancing measures do not need to be all or nothing. We can take a more nuanced approach. This isn't a light switch on and light switch off, but more of a dimmer or faucet that we can slowly adjust. In the top picture, you can see that on-off approach with the same strict measures striking down and then lifting up. But on the bottom, we see a more gradual approach with progressively tamped down hills and valleys as the cases ebb and flow. Now, this all makes perfect sense from a public health perspective, but it's extremely challenging from the legal side. It's, first of all, rare to have any law that impacts almost every person in every aspect of their life in the way these distancing measures do. But it's even more unusual to impose a rule one day and then repeal it the next week, and then impose a different rule a week later. Most legal systems are not designed for the speed that is required here. Laws normally take months or years to wind through the legislative process, and implementation can take even longer to put into effect. Now, this adaptive response approach then is going to require an agile legal system that can quickly respond to these changing circumstances. To do this, there needs to be clear authority to tighten and loosen the public health measures and provide financial and social support so people are able to comply. For example, that might mean you need the legal authority to require the shelter in place, but you also might need legal authority to place homeless people in alternative housing, like an empty hotel. At the city level, this authority needs to fit within the structure of the national laws. So you should work with your lawyers here to track the ever-changing legal framework so you can adjust your policies as needed within that structure. This requires clear lines of communication between city and national officials, but also between state and provincial officials and other cities. It also requires really close coordination among the various departments and agencies within your city. So look for opportunities to streamline the approval process and cut bureaucracy, such as implementing a rapid emergency regulatory impact assessment, which I'll discuss later. And while tightening up your processes, don't lose independent oversight though, or forget to include the public in the decision making. Policymakers are bound to make mistakes and miss some unintended consequences of these policies, and I promise the public will be quick to correct you. There's no right way to do this, and every city will need to adjust its laws to fit as needed, but the key is finding this right balance between precision and speed. Now, it's crucial that we retain rule of law in emergencies. You're going to make difficult, really impossibly tough decisions during this pandemic. And under the stress and fear, there's going to be pressure to throw out the rule book and just try to save as many lives as you can at whatever cost. But maintaining some discipline and following good governance practices will ultimately lead to a better result. In, in normal times, regulatory agencies are encouraged to conduct what's called a regulatory impact assessment before implementing any new regulations. Now, this is an evaluation process where the agency defines the problem they're trying to address. They identify all the different possible regulatory options to address that problem, all of them, and then they collect evidence and data on the likely impact of each of those measures, good or bad. Then they assess all the alternatives to ultimately decide which is the least burdensome option that achieves the desired outcome. This evaluation should be published and shared widely with the public as part of the regulatory package. And these regulatory impact assessments normally can take months or longer to develop, but they're a key tool for regulators, especially when important financial or other community interests are at stake. Now, distancing measures don't just put general community interests at stake, they affect many of the fundamental freedoms that we value most as human. Your child's education, the freedom to travel and move freely within the country, to enjoy culture and community, to practice your religion. Elections have had to be canceled or postponed. Our courts, our justice systems are closed or clogged. Businesses are closing. People aren't able to work and feed their families. And on top of that, you may not even be allowed to go to the street to protest these major impositions on your rights. Or in some countries, you're prohibited from even criticizing the government at all. So even if these distancing measures are necessary to protect life and health, which I think clearly they are, we have to acknowledge that these are major limitations on our fundamental rights. Now, under international law, governments are able to suspend or what's called derogate certain rights in emergency under specific conditions. The main principles for this temporary suspension of rights is explained in the Syracuse Principles, which elaborate on the International Covenant of Civil and Political Rights, one of the foundational international human rights agreements. Now, as a lawyer, I have to note that the Syracuse Principles are technically not binding, but they are extremely persuasive under law, and they're also good practice from a public health perspective. Now, to satisfy the Syracuse Principles and justify any suspension of rights in an emergency, you need to establish that the measures were enacted in accordance with the law at that time. That means you can't restrict rights and then give yourself authority to do so after the fact. The laws have to be in place at time. The measure must further a legitimate public health objective. So, for example, closing the borders to prevent the introduction of the virus might be legitimate, while closing the border to protect local jobs may not be. The measure should be evidence-based, and crucially, this means the measure should be the least intrusive and restrictive measure to achieve the objective. The rules must be applied or implemented without discrimination. Um, and often rules are broadly written, but only enforced for certain communities. And that would be a problem. And finally, the limitation must be limited duration in time and subject to independent review. The person with the emergency power to limit rights should not also be the person with the power to determine when the emergency is over or whether the limitations are appropriate. You need an independent source. Now, this checklist of Syracuse principles, you'll notice, is actually very similar to the normal regulatory impact assessment process. Essentially, both ask if there's a less intrusive way to achieve your objective under law. Now, what would that mean in the COVID context? For example, if you're considering banning all public transportation, you may consider allowing them to operate, but just at half capacity with additional hygiene requirements, and perhaps charging more to offset the loss of revenue for drivers. That's what Ethiopia is doing. Instead of banning funerals, you could consider limiting attendance to, say, 10 people with proper protection and hygiene. Instead of shutting weekly markets, like, for example, that are only open on a Monday, you could allow them to open for more days of the week, but spread out the vendors across the multiple days to reduce density. Cities have many tools at their disposal, not just imposing and lifting these distancing requirements. The city can also play an important role responding to the social and economic challenges brought on by the COVID response. These challenges are likely to be worse for already vulnerable people who may not have a safe home or enough food to last 2 to 3 days, let alone 2 to 3 weeks. Now, under international law, there are some rights that cannot be suspended or derogated, even in an emergency. These include the right to food, health, housing, social security, water and sanitation, and the other elements that make up an adequate standard of living. That means that you cannot legally implement these distancing measures without providing people with the means to comply. This is sometimes called the principle of reciprocity. If you ask one member of the community to sacrifice something for the common good, then the commons, all of us, should provide support back to that person. We ask people to quarantine themselves if they've been exposed to COVID, because that protects the rest of the community. In exchange, we owe that person adequate shelter, food, medicine, sanitation, etc., while they can't provide those things for themselves. The question then is, who owes this duty of reciprocity? Is it just a pressure on the immediate family or the local community? Are they solely responsible for providing this care? Or is it the city's obligation to support this person? Or perhaps a duty of the national government? I'd say we're an interconnected world, so we should consider whether reciprocity even stops at the border or whether other governments and organizations bear a duty to provide support as well. Now, the rapid tightening and lifting of different measures presents another challenge. Somehow, you have to communicate these legal requirements to every corner of the city. You're going to need a strategy to ensure these rules are communicated to people in a language they understand. Traditional media, television, newspapers, radio, internet cannot reach everyone. So you're going to need a mechanism to know whether measures are working effectively or missing the intended purpose and audience. This active listening is essential to good policymaking and for achieving high compliance. You may not be able to hold a public hearing or implement a formal comment period during this time, but there are other ways to gauge community support for the measure. You can do surveys or set up a complaint hotline or engage people through social media. You can also connect directly with community leaders or health workers who are working in the community. Listen to these concerns and address all the legitimate ones. If you engage, the community may have excellent suggestions for less intrusive measures that still achieve the public health goal. They, of course, want to be safe and healthy too. This feedback process improves laws, builds public support, and ultimately will lead to a more effective response. Now, governments can draft beautiful and strong distancing measures, but they are as worthless as paper if people do not follow them. We need people to comply with these rules. Normally, if you break a rule, there's some penalty. Lose your license, pay a fine, go to jail. These normal approaches, though, are problematic with COVID because it's so contagious. So public health officials and law enforcement are going to need new tactics to deal with people who do not follow the rules. Earlier, we talked about some rights that cannot be suspended in an emergency, like the right to food, water, and education. But there are other rights that also cannot be suspended. These include the freedom of thought and opinion, freedom of religion, freedom from slavery and servitude, from medical experimentation without consent. But they also include the right to a fair trial, which includes the right to be present at a public trial with a lawyer of your choice, to call and examine witnesses, to have adequate time and facilities to prepare a defense. Now, it's not easy to maintain physical distancing through the process of enforcing law. From police officers writing tickets, imposing fines, handcuffing accused and driving them to prison, where they sit in crowded cells with prisoners, protected by guards, waiting to meet with their attorney, and then a trial before a judge and jury and witnesses and the public. If a virus this contagious is introduced, the defendant and possibly others are almost certain to be infected. So, but your right to life cannot be suspended under international law, and neither can your freedom from the death penalty or from cruel or inhumane punishment. So the question is, if certain infection with COVID is an appropriate punishment for any crime at all, or is that cruel and inhumane? Some of your community members will violate public health rules, but public health problems require a public health solution. The focus then should be on educating the public about the law and its rationale, as well as providing effective services so people are able to comply. Even imposing a nominal fine can worsen the financial desperation for someone who already is choosing between violating the law and feeding his family. Of course, peaceful law enforcement tactics also are more important than ever. This is not a time to divert precious medical or law enforcement resources to take care of the consequences of violence. Now, people walking about the street aren't the only thing that can harm public health during an outbreak. Spreading misinformation, whether purposefully or unintentionally, can really harm the response. Rumors about possible remedies, fake stories about the cause of the virus, or false motives for certain government policies, these can have a direct effect on our response and harm people. So health officials need to provide clear, reliable, fact-based information on the situation on a daily basis, including information on the current laws and policies. Long term, we need to promote independent fact checking, education, and media literacy among our population. But sanctioning people for spreading information is not going to be an effective tactic. It's unlikely to prevent the spread and very likely to censor unpopular or minority opinions. And in most cases, it is an unnecessary infringement on the right to expression and opinion, especially when other alternatives to censorship are available. You also lose the opportunity for community engagement that is so important to effective response. So I just want to wrap up here, noting that I know many of you are technical officers working on developing and implementing policies, and you may not necessarily be attorneys. So what can you do to support this legal work? First, follow the law. Wash your hands, wear your masks, stay home. You are the face of the government, and if people see officials violating the rules, they will be less inclined to follow them. You're also not immune from this virus, and if you get sick, there may not be someone to fill your spot. Laws cannot work without people to implement them, so you need to be healthy too. Second, please reach out to your lawyer early in the process and keep them engaged. They can help you identify likely obstacles, and the good ones will help you identify alternative solutions. Third, look for opportunities to make the system more agile. Speed is everything, and we need to identify ways to make the government apparatus work faster. Fourth, engage with the community to understand why they need to comply, then advocate for them, get them the services they need. If you're in a position to adjust the policies while protecting health, do it. Scrutinize every measure and ask if there's a less burdensome alternative that achieves the objective. And finally, let's try not to think of rule breakers as if they were criminal perpetrators. Instead, let's try to think of them as non-compliant patients trapped in a terrifying medical system. Provide them with care and support rather than convicting them and sending them to prison. If we can follow these legal and ethical principles, we'll have a stronger public health response and at the same time protect everyone's rights and dignity. I really appreciate this opportunity to speak with you, and I think we have some time to open it up for questions and answers.
Thanks so much. That was really wonderful, Aaron. We do have a number of questions that have come in, and so let me pose some of them to you. The first of which is, what lessons were learned from Ebola in West Africa that could inspire COVID response in legal terms?
That's a really great question. I think some of the crucial questions, some of the crucial answers, and I've highlighted this in mine, is to get ahead of security incidents before they happen. And that means deep community engagement, listening to people, understanding the fears, and thinking about some of the unintended consequences that might happen. So if there's a strong action early in the crisis. So, for example, if the police come in and start locking people up, this might create fear in the community, which causes people to go underground and not engage with the health sector, or perhaps flee the town entirely and try to get away from this. And what this can inadvertently do is actually cause the disease to spread further. So being really careful to communicate clearly with the people, to not come in necessarily with the police force, but really frame it as a public health response. Treat people with respect early and often throughout the process. You can avoid some of these challenges.
Great, thank you. Another question, and maybe it refers to the picture that we started with in the first place that your poll revealed some answers, and that is, what could be done legally if health workers do not want to go to work because they have not been provided with personal protective equipment?
There's the phrase, you can lead a horse to water, but you can't make it drink, and I think that's unfortunately very true in this case. Our health workers, our doctors are absolutely the core to this, and if they don't have personal protective equipment, we're all going to suffer. Not only if you force them to go to work without this equipment and put their lives at risk, you might have a few weeks where you're getting them to work, but they're almost certain to get sick and be out for much longer at this point. So we need to work collectively to ensure that they have sufficient PPE. Arresting them, forcing them might be a temporary solution, but it's not going to ultimately solve the problem, and it's much likely to make it much worse in the long term.
Great, thanks. We have a question from Los Cabos, Mexico, where someone asks, is there a manual for evaluating policy applications or measures in the midst of the crisis? Or any other kind of evaluation mechanism that would let us know how we're doing?
Um, we do have some tools that I could share with you, some evaluation tools after, and I'm happy to reach out. Ultimately, every legal system is quite different, and depending on whether you're a national government, city government, what the structure is, there's going to be different tools and mechanisms you have. So I really don't want you to see this as a one size fits all approach, as if you check certain boxes, you're going to succeed, and if you don't have all of those things, you're going to fail. That's not what the situation is. Ultimately, the measure of success will be whether your government is working collectively with the people to contain the virus and provide them the services that they need in order to comply with the rules.
Right.
Um, yeah.
Yeah. Um, a question that's an interesting one, which is about the sort of scarcity of access to lawyers, and the question is really about how people in, say, a suburban population in an African metropolis could reach a lawyer, or how do we pass on messages that there are abuses if people don't have regular access to lawyers? Um, any thoughts about that?
Yeah, I mean, that's a really important point. First of all, one of the fundamental rights that we all have, even during an emergency, is the right to seek appeal for a violation of our rights. So you should have access to a court, even when the courts might need to be closed at this time, to appeal. Again, that's why it's so important to have these alternative lines for people to complain and provide feedback to you about abuses early, because it's really difficult to keep a court open during this time. There are not going to be enough lawyers to go around during this time to deal with all of this, but luckily there are other really excellent organizations out there internationally that can help. groups like Human Rights Watch or Amnesty International or others that, and local chapters of those groups that can really help. And I hope the population has access to those and is able to get the story out. The media also plays a really crucial role during this time. And that's why, again, any restrictions on the freedom of the media to report the stories, even if they're critical of the government, are so crucial at this time.
Great, thanks. All right, one last question, and then I guess we'll move on. In the UK, the government's proposing lifting the lockdown only for people who are under the age of 70. And the question is really, is that going to be classed as arbitrary and discriminatory policy under international law?
It's interesting. So Bosnia actually did something similar initially. They issued a state of emergency that prohibited people under the age of 18 and over the age of 65 from going out in public. And their constitutional court actually looked at this and decided that the restrictions for elderly and minors to stay under lockdown was discriminatory. But what the court said was that the government had failed to demonstrate that they had considered less intrusive measures, and they hadn't shown any evidence that children and the elderly carried a higher risk of others of contracting or transmitting the infection. So it's not just the mortality, but actually this question of contracting and transmitting it. The court also said that the age ban wasn't strictly limited in time also. So I think it's not necessarily discriminatory to do this as long as you can show you looked at less intrusive measures and that there's a strong evidence base for keeping people over 70 for that. So if the evidence shows it and you've considered measures, it might not be discriminatory.
Okay. We're going to move on right now, Aaron, and I want to thank you for your thoughtful responses to these. But we'll have another question and answer period, and I want to ask you if you'll stick around and also help us through there as well. And then I want to let everybody know who has been chatting questions to us. If we haven't had a chance to answer them directly, we will get back in touch with you and provide some answers to you. So I want to move on, and I want to ask all of you right now for some insight into your concerns about the legal issues that you're facing in your city. And I'm going to release a second poll right now. And that should say, what are the most pressing legal issues your city is facing in your COVID-19 response? If you would, just take a moment to answer the poll before we move on to our next speaker. Okay, now I'd like to introduce Dr. Chiluche Onyamalukwe. She is a managing partner in ethics, health ethics and law consulting, and an associate professor of law at Babcock University. She consults extensively on public health law and related matters, and she has supported the work of Resolve to Save Lives in Nigeria and is doing legal response work to COVID-19 there as well. Now, let me again remind you, feel free to put your questions into the QA function as they occur to you, because we'll be coming back. And then please welcome Chiluche right now.
Hello, thank you very much. It's been a pleasure sitting here and listening to Aaron talk. And I just have a short time to say a few things about our response here in Nigeria. So I'm going to be looking at the legal and policy responses to COVID-19 in Nigeria, and I'm going to focus a little bit more on Lagos State. So I'm just going to give you a brief background about how we came by our own cases of COVID-19. Look very, very briefly at the legal framework in Nigeria, zeroing on Lagos, look at some of the positives and some of the challenges that we faced, and then some lessons that I think might be helpful for policymakers coming from Lagos and for Nigeria. Okay. So as some of us would know, Nigeria is an African country in West Africa, actually, with about 200 million people, and is the second largest, the second most populated country in Africa. So what that means for us, of course, is that if we are not able to manage our COVID-19 situation properly, we will have quite a big problem, not just in Nigeria, but in, at the very least, the West African countries. We had our first case in, on February 27 this year. Somebody who came in from Italy, an Italian who came in from Italy, who worked in Nigeria, and that was the first case. And the interesting thing, of course, just like with our Ebola situation back in 2014, was that a hospital was able to identify, a private hospital that he visited was able to identify that he had symptoms of COVID-19, and he was tested and it turned out to be positive. Since then, and even before then, our National Public Health Institutes, which I will call the NCDC, the Nigeria Center for Disease Control and Prevention, has been at the forefront of providing us with the requisite information and working with states. Now, I need to say a few things about how we're set up as a country. So we're a federation, so we have the federal government, and then we have the states governments. And without getting into too much of the legalese, public health matters fall, the states have certain authorities over public health, and the federal government also has certain authorities. The NCDC that I've mentioned is a federal agency. So basically, it's under the law that established it in 2018. It has the responsibility of ensuring that we detect and control diseases generally in Nigeria. But of course, the states also have their own public health laws that allows them within the states to detect and respond. Now, and this is work that I did with Resolve to Save Lives. Some of the assessments that we did prior to COVID-19 showed that we had quite a bit of work to do on our legal framework because it wasn't perfect. It had, we've not worked on it really extensively for a very long time. So our Quarantine Act comes from 1926, for example. And so, as you might imagine, it's quite outdated and doesn't really say very much that would help us in the kind of situation that we found ourselves in with COVID-19. And basically also, I should say that quarantine itself is an exclusive matter under Nigeria's constitution, which basically means that it's the federal government that gets to make decisions about that. So we have this sort of situation where you have the federal government making very important decisions around quarantine, but you also have other issues that the states have to manage within their authority. So for example, state hospitals, isolation centers, and things like that. And these are not even things that we have really addressed in our laws. So we, in a sense, COVID-19 met us trying to figure out a legal framework, and some of this has shown up in our response. So with COVID-19, what we've then basically had to do was to prepare regulations under the Quarantine Act, which is just a very brief act that has less than 15 sections that more or less just gives the president power to declare a place, an infected local area, and then to make regulations based on that. Now, the president has made some orders which were eventually set up within regulations, and basically what that has done is provide restrictions, lockdown about 3 states where we had the highest incidences, Lagos State, Ogun State, and the Federal Capital Territory. Closing of all the borders, land, sea, and air, and in fact, also prohibiting internal flights. So we can't fly from one state to another. It also provided some mitigation measures, some of which the kinds of things that Aaron talked about earlier around, especially around loans and loan forgiveness and getting the Central Bank of Nigeria to more or less within fiscal policy, do something around ensuring that businesses do not go under now because they are not able to meet their loans. So, and eventually we've also then, as part of the legal measures that we've taken, granted pardon to several categories of prisoners. So we've been in this situation where you've had the president more or less lock down 3 areas, but other states have gone ahead also to lock down their states, if you will. We haven't, when all this is over, we'll probably go back and look at those kinds of legal responses, but these are not things that are anticipated under our constitution. I'll tell you what that means in the end, but let's carry on. So we've had the president's regulations and so on, but the states themselves have also taken measures. Lagos State in particular, I should say a few things about Lagos State just to give you a picture. Lagos State is a state, a city, well, of about 21 million people living in a very small area. In fact, it's the smallest state in Nigeria, but it is also our commercial capital. So most of the businesses have a presence in Lagos, and most of things that relate to commercial transactions are primarily done in Lagos, and it is in fact a commercial hub even in Africa. So you have quite a number of people living in such close proximity with each other. And the government of Lagos State has taken several legal and policy steps to manage the situation. Lagos State also has the highest incidences, and in every day we record now double digits, and it's been shown that we now have community spread in Lagos State, and that's a big deal. Prior to COVID-19, Lagos State enacted its public health law, which is a 2015 law. And so it's one of the few states in Nigeria that's actually done something about its about public health and about emergency response and emergency preparedness. And so that gave some legal footing to some of the actions it's had to take, but it wasn't. It's not been enough, because some of what we've experienced, lockdown, distancing, or businesses not being able to open, were not necessarily anticipated in that law. It's also operationalized its COC. Incidentally, this is also its Emergency Operations Center, which has worked with the National Public Health Institute, the NCDC. Interestingly, this is also not something that is in its law, but it has had to do something because of the situation in which we find ourselves. The isolation centers were not in tip-top shape until an exposure was done just before the cases began to rise rapidly. And right now, the state has done quite a bit of work in the area of improving its isolation centers, and in fact, they've designated some more. It's also to address the situation past the infectious disease emergency prevention regulations, which designates COVID-19 and infectious disease, certain relevant provisions, and so on. This was prior to the federal government doing so, but the federal government regulations, of course, because of what I told you before, take precedence over what the Lagos State has done. interestingly, even though our legal framework is still in a state of flux, is imperfect, and all of that, there's been relatively little wrangling over who has authority for what, which can happen, and that is why you really need a comprehensive, a properly done legal framework. But we've, to some degree, not completely, but to a certain degree, have escaped, some of the wrangling that you could have expected with who has authority for what, who can do what, who can make pronouncement on what, and so on. And so to a large degree, the federal government has not interfered with states on the steps that they are taking. Lagos State has also tried very hard to work very closely with the federal government. So states have, to a significant degree, though not completely, taken on board the NCDC advisory. Okay, so at the end, I think my time is running out. I just saw that. Okay, some of the challenges, we've had some good things happen. People are keeping to the social distancing rules. We've had some palliative measures done, but as it is, those measures have not been enough. And even though the cases are rising, we find ourselves in a situation where, in a state with a very large informal sector, we now more or less have to open up the economy because there's going to be unrest if we do not do so. So the question is, how do you manage the easing into life without having cases go up quite a bit? We've also faced some challenges with inconsistent enforcement of the law and a lack of comprehensive legal framework. I would say that for us, one of the things that I would say is that we need to think, as we look at restrictions, we need to think very carefully about mitigation, about mitigating the measures, because that then also has an impact on how effective the legal framework is, and how you go about improving the lockdown. I think I'm just going to stop there. I think is my time up, and maybe take some questions that we might have. Thank you.
Thanks so much, Chiluchi. We really appreciate your great talk there. We did we did have a question that actually picks up right just at the end of what you were saying, which is, and builds on the results from the poll. Nearly 75% of our attendees said that the major thing that they're facing right now is the legal difficulty is in enforcing physical distancing. And so we had a couple of questions that were just about like how to deal with the need for contact tracing and patient confidentiality, especially if we're going to try and open up economies. And I wondered if you had any thoughts about that.
Again, I guess that depends on where we are in terms of contact tracing. One of the things I was going to say, if I had a little bit of time, was that it's important to have a legal framework that allows a level of flexibility. I think that's one of the things that's come out in terms of COVID-19, so that you can make regulations and so that you can address some of the arising issues. So questions around contact tracing, around patient confidentiality can be addressed in those in those kinds of regulations. And some of them are, even though you would have probably a general health law that say, patient confidentiality needs to be maintained except in certain circumstances, and they just maybe include the provision on public health. It doesn't actually tell you whether we need to get into a space, for example, where people need to have a sense that this location maybe has a higher number of cases. This is something we need to take care of. So having that flexibility. So I mean, your law should reflect what your circumstances are, I think, to a very large degree, and comply with human rights standards, just like Aaron had mentioned. But it needs to, you need to have that flexibility to address the specific situation that you're facing. And that's what, we're finding, that you need to be able to have a framework that allows maybe some regulations to be made administratively, that still has some force of law, okay, that doesn't then, it's not so tight. It allows a little room so that you address things that are on ground. In terms of contact tracing obviously is one of those things. We need to do contact tracing, but you also need a legal framework that allows you to do that, because that's how we're going to be able to manage the situation.
Thank you. We did also have a question, just a specific question, which was, did Nigeria give, kind of basic needs to vulnerable people during the lockdown? And if so, can you share the criteria that they used to determine which vulnerable people would be eligible to receive essentials?
Okay, so that was one of the things that I was going to address as our major challenge. In Nigeria, we have a challenge with vital statistics. We haven't really, over the years, maintained a good database of people, and we still don't. So what we found was that some people seem to have benefited more than others. Some states, for example, that have been part of what we call an incentive that we call the conditional cash transfers, have benefited more. Each state has done what it could, but again, because you don't have those vital statistics that determine how many people there are, who they are, how much they earn, and so on, it's been very difficult to actually implement even the good palliative measures that are in place. And in fact, that is one of the reasons that we are more or less opening up, even though our cases are rising.
Great. Thank you so much. I also want to thank you just for giving us your time today during the webinar. We're just at about the end of our hour together. So I want to remind everyone that we will be getting back in touch with you if you chatted questions to us and we did not get a chance to answer them. And now I just want to move right on and end on a few things. The first of which is I want to draw your attention to Partnership for Healthy Cities website, which is citiesforhealth.org. There are a variety of resources there in English and in Spanish and in French. And the ones here in purple on the right side of your screen, they relate to the issues that we discussed in today's webinar. You'll also be able to find a recording of this webinar there by tomorrow at some point, should you want to share it or review it again. Now, be sure to look out in your email for the invitation to next week's webinar. We're going to ask also for volunteers who want to share challenges or successes in one of the areas in special considerations for city action, the way we did today. So please contact us directly, either through the Q&A right now or afterwards if you'd like to participate. Now, let me also draw your attention to two webinars that are going to be happening next week. The first, on May 5th, is for mayors and chief executives in cities and will focus on legal and ethical issues pitched to them. And we urge you to let the leadership in your city know and to attend if they can. Then, on May 7th, during this series, we'll be focusing more deeply on adjusting physical distancing measures as you descend the epidemic curve. Now, I'd like to thank Bloomberg Philanthropies, the World Health Organization, Vital Strategies, and the Partnership for Healthy Cities for making this webinar possible. I'd also like to thank our speakers for their really stellar presentations and their wisdom today. And last, I'd like to thank all of you for attending. Have a safe and healthy week, and we'll see you next Thursday.